You're watching UNICEF television.
This is the front line in the battle against Africa's biggest killer. Hundreds of Congolese women are queuing up to arm their families with the best known form of self-defense, mosquito nets. It's a small part of one of the biggest interventions against malaria the continent has ever seen. After half an hour waiting in the sun, it's Leontine Nganyema's turn. The nurse tells her how to use the nets and registers her name. One more household in a campaign to distribute 15 million nets nationwide by the end of the year.
We give nets according to the size of the household, and to this woman we gave 4 nets, because there are 9 people living in her house.
Malaria kills nearly 200,000 children in the Democratic Republic of Congo every year, and like many families here, Leontine's 4 kids have all been badly affected.
My children had malaria and we didn't know how to protect them. It was awful. All the time we were going to the clinic for medicine. They kept vomiting and getting dehydrated. Every 2 months they would get sick like this.
Not far from Leontine's house, a visit to the local hospital shows the importance of prevention as opposed to treatment. Already chronically under-resourced, 40% of the patients here have malaria.
A mosquito net costs about $6. Considering transport costs and the size of the country, that takes a lot of money. With our lack of resources, we can't afford them. So it's important we get help to make them available for everyone.
Getting the nets to remote Congolese communities is a huge logistical operation. Packages of nets are shipped, trucked and carried before being handed out by local health workers. For those who work on the project, there's a firm conviction that this is an intervention that works and saves lives.
When people use impregnated mosquito nets, there is a reduction in the levels of mortality. It reduces the number of malaria cases in families that use them. In provinces where we have distributed nets and the population uses them, we've seen a reduction in malaria cases in children under 5.
At health centres and public demonstrations like this, the message is now being spread. In a country brought to its knees by conflict and corruption, the struggle against malaria is one war that can be won.
Jonah Fisher, UNICEF Television,